Welcome, I'm Enrico Maraschin. I'm a pediatrician practicing in Morningside in South Africa. This is my passion, little children. I love seeing children in their natural setting, learning, discovering, going to school, playing sport and staying happy. Here we have the vaccine schedule that is produced by the Pediatric Management Group of South Africa, and we can see from the schedule, very busy slide, and by the time the child gets to 12 years of age, we see that there are lots of injections and lots of holes in this poor child's skin. However, on the left-hand column, we have a long list of illnesses which we're going to consider today. Chickenpox, or varicella as is the scientific term. The presenting symptoms include fever, rash, severe itch and respiratory symptoms. Generally, most children recover uneventfully. However, in the USA, 10,000 hospitalizations and 100 deaths occurred annually prior to vaccination. The illness cost the US economy $400 million in medical costs and lost wages from caregivers having to attend to their children annually. In our pictures on the right, we have a child who barely has a spot on its skin that has been spared such an infection, and luckily many years ago we had such a patient in our ward, and in fact the itch and the pain and the discomfort and the agitation was such that we had to sedate this child completely just to cope with such an illness. On the left-hand picture, we have a child whose eye has been infected with chickenpox, and this is a severe manifestation of the illness and requires urgent treatment with antiviral agents.
So, having considered the facts pro and con vaccination, what is your decision? I came across this site on the internet. I consent to being forcibly restrained and injected with multiple viral strains, preservatives and heavy metal adjuvants. Said no baby ever. Having looked at all the facts in our talk, you can see that the effects or side effects of the vaccine are very small if one compares it to the devastating effects of the illnesses that we deal with. If we have a look at the right-hand slide, we have a child who's fully immunized and protected against these life-changing illnesses. In my opinion, if I had to choose, I would choose to vaccinate my children fully, with the knowledge that we are placing these children at risk if we don't vaccinate.
So thank you for joining me, Enrico Maraschin, in this discussion. I hope I've shown you the reason for my passion for controlling the disease processes that we vaccinate against, and I hope it'll give you some insight into making your own decision of whether to vaccinate or not vaccinate.